Every year, nearly 800,000 Americans have a heart attack. And of those, 210,000 occur in people who have already had a first heart attack. Dr. Jon LaPook tells us about a potential new avenue to reduce that risk.
After 2 heart attacks, 68-year-old Phyllis Reed quit smoking, lost 30 pounds, and took statins to reduce cholesterol. And yet, she worries.
I'm afraid of having another heart attack. It's just something that just ever goes away.
Now, there may be one more way of lowering her risk, by reducing inflammation, the body's response to injury. Researchers tested a powerful anti-inflammatory drug called canakinumab in people with a history of heart attack. 10,000 patients with blood test evidence of ongoing inflammation were followed for about 4 years. There was a 15% reduction in the risk of heart attack, stroke, or cardiovascular death compared to those taking a placebo. Dr. Paul Ritker of Brigham and Women's Hospital was the study's lead author.
Everyone in this trial already had very aggressively lowered cholesterol levels. The question was, could we attack the residual inflammatory risk, not the residual cholesterol risk? And it was a home run.
For 2 decades, Ritker has been researching the role of inflammation in heart disease. Damage to the wall of an artery can trigger inflammation and growth of fatty cholesterol-rich plaque, which may eventually rupture and form the type of clot that causes a heart attack or stroke.
Diet, exercise, and smoking cessation and going to the gym remain critically important, and everybody should really get their cholesterol down, working with a physician to do so. But this is an entire new part of the disease.
This drug, which is already approved for rare inflammatory diseases, came with an increased risk of serious or fatal infections. Researchers will need to investigate that further, but they're hopeful this is only the beginning of an exciting new approach to treating heart disease. Dr. Jon LaPook, CBS News, New York.